Hello, my name is John Pumford. I'm the Manager of Clinical Research at Phonak Lyric, where my role is to oversee all clinical validation activities related to the Lyric product.
My name is Michelle Griffin. I've been an audiologist for 8 years. I spent the first 6 years of my career in private practice settings and the last 2 years here at Lyric.
So many times I'm asked, what is an audiologist? And unfortunately that often comes from family members, which I thought at this point they'd actually understand what it is I do every day. But the reality is, in terms of if we're thinking of what is an audiologist, it's really the primary, I would say, hearing healthcare professional who's involved with the diagnosis, management, treatment of hearing-related disorders, tinnitus, imbalance conditions.
Audiology is a wonderful profession to get into today. In fact, it was actually rated as the top 6 profession in 2012 by the Wall Street Journal. There are a variety of opportunities that you can have as an audiologist. Most clinicians will work in the settings of a hospital, a private practice office, or other clinic.
They'll work in various academic institutions and training capacities. They may work in government agencies around, for example, hearing conservation programs, or work in research centers, be it in academia, or also in industry, as I've done in the past. So in terms of becoming an audiologist and getting the training required to practice the profession, some of it will depend on the part of the world that you're from. I'm from Canada. So in Canada, the training requirements at that time are you're needing to have an undergraduate degree, 3 or 4 year undergraduate degree with primarily science or biology type courses, at which time you would then apply to a master's level program that provided specific training in audiology. And depending on the institution at which you enrolled, that would either be a 2 or 3 year master's levels training.
To become an audiologist in the United States today, you must have a doctorate level degree. Most people will get their Doctor of Audiology, which is an AUD, and some others may get their PsyD or a PhD. The training to become an audiologist can be quite rigorous. It actually will take you 4 years. The first 3 years are spent in the classroom and in the clinic, with the final year being a full-time clinic opportunity where you have full supervision.
In the last 16 years working as an audiologist, I've seen a lot of different changes. First of all, in the assessment area, we've seen now new technologies, advanced technologies that have allowed us to accurately diagnose and assess hearing loss in very young patients, down to newborns, which is an exciting opportunity, especially given everything we know about the importance of providing amplification and managing hearing loss as early as possible. I've also seen significant changes, as we've seen in other consumer industries, related to computer technologies and their use in hearing instruments. So back when I first started, a lot of adjustments with hearing instruments, for example, involved the use of screwdrivers and trim pots, and now we're to the point where we're actually able to use computer systems to accurately manipulate the settings, the output settings of hearing aids in various ways to ensure that it's more appropriate for people with hearing loss. And we've also seen significant advances in terms of the types of devices that we're putting into patients' ear canals to help assist them with hearing loss. And that, in fact, was one of the big draws for me to come to the Lyric team, was the development of an industry-leading and world's first extended wear deep canal fitting product that is left and worn in the ear canal for months at a time. Something that, again, when I started 16 years ago was unheard of.
I got into the field of audiology because I really wanted to help others hear. I grew up with my own ear-related issues, many ear infections and medical issues with my ears. And now it's my chance to help others with hearing difficulties. The great thing about Lyric is that I can help people hear, not only hear, but also live their life the way they want to. They can still do all their activities without having to worry about their hearing loss.
Lyric from Phonak. Life is on.